Okay. The next one is genre and style. What is that, genre and style?
Oh, I don't know.
Mm. Have you heard the movie genres or music
Yes,
genres?
yes, yes. About the movie and the music, I know that. But about the letters, I don't know.
Okay. So it explains here. Does the letter have appropriate register and tone for its purpose and audience? Okay.
Yeah.
Uh, what is that? Let's see. So number 4 is genre and style. Okay. And this means that appropriate register and tone.
Yeah.
Okay.
Yeah.
Um, um, the register of a language is where this language is spoken and how um, basically is it spoken um, in a court or in a surgery, in a hospital, on the street, or in a bar. Okay, so
Yes.
the language which is spoken is different.
Yes, exactly.
So you cannot talk slang in a formal setting.
Yeah.
Uh, how do you speak in or how do you write in clinical situations?
I think that is formal
Yep,
stuff.
it's rather formal. Okay,
Yeah.
so it's actually we use a clinical and factual language and non-judgmental. Okay,
Hmm.
so we cannot say someone is fat. Okay,
Yeah.
okay, we go here. Clinical and factual. So that is the register and professional register and tone. Okay, what is professional register and tone?
I think that we need right as a doctor
Yeah.
to others health professional.
Okay, and it needs to be somehow respectful. Okay,
Yes, exactly.
we don't write. We're not writing a complaint letter. We're not writing a sarcastic letter. Okay,
Yes.
so basically, what we're writing is a respectful letter, and it is appropriate to that audience, to the person we're writing. Um, Now the question is abbreviations and medical jargon. Could we use them?
No, no, no. Never, never, never use it.
I don't agree. It says here abbreviations and medical jargon used appropriately.
Yeah.
This means that a reader from the same medical discipline, you can write medical jargon and abbreviations. But for a reader from a different medical discipline, you need to think, you need to see whether they would understand it. And for a non-medical reader, yes, you don't write it. You don't write any abbreviations or medical jargon.
Oh, yeah.
But remember, most of the time you're writing a letter to refer, discharge, or transfer a patient.
Yeah.
But in any case, so abbreviations and medical jargon used appropriately.
Oh, yeah. It's great.
So basically, I don't agree if someone says write everything like blood pressure or now suppose you're writing to a gynecologist.
Yeah.
Do you think a gynecologist knows what LMP is?
Uh, I think that surely no.
Okay. Can you tell a gynecologist G5P2AB2?
No.
What does that mean?
As a as a GP, I don't know.
Oh, come on.
Yes.
Gravida 5, Para 2, Parity 2, Abortion 2.
Oh, yes, yes, yes. I know that. No, I remember that. Yes, I know that. Yes, 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 exactly.
Okay. So a gynecologist knows what BP is, what PR is. Yeah?
Yes, exactly.
Okay. So how about DM?
I think that yes knows that.
Okay. And HTN,
Yes,
IHT,
yes, as the same.
MI.
Yes,
Okay. So if you're writing to a doctor, you can use these uh, for doctors. Okay. Now, if you're writing to a nurse, you need to think. Now, if you're writing to a midwife knows this.
yes,
Yeah, that's fine. If you're writing to a nurse, they would probably know about these.
yeah,
Okay. So, depending on who you're writing to, you can use abbreviations and medical jargon. Okay. Any
yes.
problem?
No, 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 thank you. And do you have a list of appropriate jargon or medical abbreviation and share with me?
I don't have a list, but there are lists. You can search, but yeah, I don't have any really. I
Thank you.
I can have a look. Okay. But the next one is organization and layout. Okay.
Yeah,
Let's see what this is. Uh, and layout. Right. So, uh, appropriate paragraphing.
yeah.
What does that mean?
I think that is classified. For example, one paragraph for the social or past history, one paragraph about the today's visit, one paragraph about the conclusion.
Okay. We will talk about this later.
Yeah.
Um, logical organization.
I think that is the chronological time, maybe.
Okay. It needs to have a logic.
Yeah.
Okay. Key information clearly highlighted. What does that mean?
Uh, I have no idea.
Okay. Uh, so you remember we talked about key information. Okay.
Yes, exactly.
So we know what key information is. Key information is essential and good to know information.
Yes.
So what we don't know here is how we highlight them. Yes?
Yes, exactly.
Can we highlight them with a highlighter?
No, no, no. I'm sure that maybe with a kind of writing or
Okay.
a kind of words, or I don't know.
How do we highlight?
Maybe please note it is mentioned that,
Good. Okay.
uh, or I, I, I have no idea more than this.
Okay, so we can use something that we can use discourse markers, as you said, like please note, or we can say it is important. Okay,
Yeah.
so we can use some discourse markers, but we can use other ways as well, um, like earlier in a paragraph. Okay, because at beginning of the paragraph is usually most noted. Yeah.
Yes.
It's like a main idea you're giving at the beginning of a paragraph, and the rest is supporting information.
Yes. 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 Exactly.
So, if you want to highlight something, you put it at the beginning of a paragraph, and you actually mention that this is something which is important. But please note doesn't work for every audience. Okay, you can say please note this to someone. For example, you're writing to a nurse or you're writing to a colleague. But if you're writing a referral letter, you don't say to a consultant, please note. It is too strong. You need to be a little bit. You can say, may I draw your attention, or may I emphasize, or something like that. Okay.
Yeah.
So, um, an appropriate layout. What is that? Appropriate layout?
Appropriate. I think that how to write the address or maybe how to
Exactly.
ending
Exactly.
it. Yeah.
Exactly. So basically, it needs to have the format of a letter, and that is how we write it. Okay, good. Any problem here?
No, thank you.
And so we go to the next criterion, which is language. So, what about language?
Uh, Language is English, and
Does the letter have suitable and accurate vocabulary, grammar, spelling, and punctuation?
yeah,
Okay, suitable and accurate.
yes,
Uh, suitable and accurate. What? Grammar, vocabulary, um,
punctuation,
spelling,
spelling,
and punctuation.
and maybe the article.
Uh,
Oh, it's included in grammar.
yes. So the language used needs to be accurate, used appropriately, not interfered with reading comprehension or speed. Okay, comprehension or speed. So these are important. Okay, so accurate. Um what else was there?
Um,
Appropriate
yes,
and not interfering with reading comprehension or speed. Okay, what does that mean?
mm.
It means that the reader needs to read easily and quickly.
Oh yeah.
Appropriacy is more important than the range of linguistic features. Okay, what does that mean?
Uh, Range of linguistic features, maybe different tenses
Mm-hmm.
or different linkers.
Good. So, appropriacy more important than range. Okay.
Yeah.
So, I mean, in some examinations, we might tell you you need to you need to use a lot of different vocabulary items, or you need to use a range of grammatical structures. but not here. Here, the appropriate language is more important. Okay? In some examinations, we say write in addition, besides, however, and that sort of thing. It is not here. It is not the case. We want something that can be read very quickly and with speed.
Yeah. We cannot use we cannot use however, although, or in addition to. Yes.
Uh, yes and no. So it's
Oh yes.
actually um, we need to look at those later.
Yes.
Yeah, we will.
It's okay.
Okay. Okay. So now, now that you look at here, we have 1, 2, 3, 4, 5, 6 criteria. Okay.
Yes.
And how many of these criteria is language?
Uh, 1 out of 6.
Okay. So what do we need to do to score high in this exam?
I think that is better concentrated more other uh, criteria except of language. No?
Okay. Hmm. So basically, they say, um, these are the slides for the teachers. Okay, this is for teachers training. This is what we had for when we were training to teach OET. What it says is there is a strong focus on creating a letter which is relevant to the reader within that particular context. Okay,
Yes.
so relevant to the reader in that context. Reader context. Okay,
Yeah.
there is lower focus on grammar than other writing tests. Obviously, there's not much focus on grammar. I need to be flexible rather than plan one exact way to write every OET letter. Flexible, and that's what we want. Using templates for writing is strongly discouraged. Okay, so
Yes.
strongly discouraged is just one weaker than is forbidden. So it's nearly forbidden. Is strongly discouraged. It means don't do this. Okay, if
Yes.
you do templates, you will lose marks.
Yeah.
Okay,
Yes. Yes.
so the tasks are the same, they're not changing. The difficulty of the task is the same, only the marking criteria changes. Ensure the purpose of the letter clear is in writing tasks. And that is because if you get the purpose wrong, the whole letter is wrong. Okay?
Yes.
And it says you need to, it's for teachers, it says update in-house sample answers. It means change the sample answers because they're no longer relevant. All official OET content will be updated soon, okay? And update curriculum content. Uh, so uh, basically, the changes are writing sample answers have a big change. Minor changes, test strategy documents, purpose immediately apparent. So you need to emphasize this, and less importance of grammatical range. So it's no longer necessary. What doesn't change is the practice tests and skills. All right?
Yes.
Okay. So, uh, is that helpful?
Yes. Surely.
Okay. So, with knowing this, now let's see how we can actually approach uh, the writing test. Okay.
Yes.
Um, so, we go to the approach. Right. So when we are given a case note, uh, you are supposed to read it for 5
5 minutes.
minutes. Okay.
Yeah.
So read the task. So when we are reading the task, what should we read? Which parts?
The first uh, I read the end of letter to which we refers or transfer how is the letter referral discharge or etc. And if the refer to who we try to refer the patient.
Yes, very good. We read the end first. Why? To find out who is writing to whom and why. Okay,
Yes.
good. Um, then what do you read next?
Uh, I usually read the start reading the case note from the first.
Okay. Uh, I suggest you read the last consultation or the last entry
Oh, it's great.
because that is the trigger for the letter.
Mm-hmm. Amazing.
Okay.
Yes.
Do you accept?
Yes.
Agree that.
Yes.
Okay. And then you read the rest. Okay.
Yeah.
Good. So that is 5 minutes. And in these 5 minutes, when you're reading the rest, what you're looking for?
Uh, from the first consultation and after that the sequential follow-up visit. No.
Hmm. You look for key information. Okay.
Yeah.
Okay. What are the key information?
It's completely related to who is right, whom is going to read this letter.
Okay. So basically, that is essential and good to know.
Yeah.
Good.
Yes.
Yeah. Okay. So that is 5 minutes, and the 5 minutes have passed, and then you can now start read the task and mark. What should we mark?
Uh, I think that is better to highlight it, the appropriate information, and focusing on to write this.
Okay, essential and good to know.
Yeah.
Okay. Now, sometimes I suggest what you can do, which could be helpful, is to decide uh, where this um, uh, the matter starts. Okay, suppose you have, in our GP surgery, I had a patient note, and this patient note might have something like 50 entries. Okay,
Yeah.
but when I want to write a referral letter, do I need to read all these 50 entries?
I think that no, is the need to select the information
Hmm.
for whom and related, completely related to for why we decided to refer and for whom we are writing.
Okay. So basically, we go back to the beginning of this matter. Okay. So basically, if you have 6 entries and 3 of them is because of headache or a stomach pain or diarrhea, and then you want to refer this patient for headache, then you need to start from headache, okay? You don't actually go back to other problems which are not relevant.
Yeah.
Those might go to the good to know or to uh, they might be relevant or maybe not. Okay,
Yeah.
good. So you go back to the beginning and decide uh, what in what order. Decide on the logical organization. Okay. What is a logical organization? We usually say you can use SOAP. Okay. Do you remember that? Subjective Objective Assessment Plan.
Oh, yes. Many years ago.
When you're writing a sort of um, um, what do we call it? Progress note. When you're
Yeah.
writing a progress note, you first say, okay, how the patient is feeling, what they're saying, then your examination and what you can find objectively, then what you think the assessment is. Is the patient stable, not stable, is better, is worse?
Yeah. Yeah.
And your plan, for example, discharge or transfer or change medications, whatever.
Yeah.
Okay?
Yes. Yes.
Right. So, if you're going to, again, about logical organization, if you're going to talk about a patient's test results, um, do you say, which one do you say first? For example, you have blood tests, urine tests, x-rays, ultrasounds.
I think that maybe the lab finding is the first, and after that, saying about the X-ray or
That's right. And then x-ray, and then ultrasound, then CT scan. So it is the same way that everything has been introduced, okay? Or the same way that you perform,
yeah.
okay?
Uh, you need that. You say that when we start to writing this, the order of, for example, a patient has one X-ray, one sono, and one CT. And in order to write up this need to adopt it with the case note. If the case note, the first mention about X-ray, we need to write the first X-ray in my letter.
Mm-hmm.
Is it
Uh,
okay?
we need a logical organization, okay? Do you remember this in organizational layout? We need a logical organization. So even if in case notes it is not logical, you need to change the place, okay?
Yeah.
Or if the patient has had 2 X-rays, you just say, okay, the patient had 2 X-rays. The first one was normal. The second one was this.
Yeah.
Okay.
Yes, I know. Yes, thank you.
So after you read the task and mark the essential and good to know information, and you decide on your organization, you start to write. Okay.
Yeah.
Okay. So uh, so write. Okay. You write the letter. Where do you start?
From the top of and start with
Okay.
address,
Receiver,
receiver, yeah. Then name,
uh, date,
address, date,
salutation, dear, whoever it is,
yeah.
and then uh,
Patient.
reference patient's name and date of birth. Why date of birth is important?
I think that is for identify the patient.
That's right. It's a denominator. It's basically like the father's name when we used in Iran. Okay.
Yeah.
So, and then the next one is the purpose. Okay. So early in the document, the first paragraph in the letter is purpose. Okay.
Yeah.
And then you write about, you summarize essential information efficiently and effectively.
Yeah.
And then you can also write the good to know, good to know information in next paragraph. Then in the next paragraph, you write what you expect or the plan. Plus any relevant connection or side matters. What does that mean?
Mm, I have no idea.
Uh, okay. Um, sometimes you're talking to your partner and the kids are around and you don't want the kids to hear. Okay. So you just say, okay, the kids. And what does that mean?
For any disturbance or
Hmm?
anything.
So it means be careful, the kids are around, okay? Or um, you're talking to a consultant and you say, okay, you see, this patient keeps coming to my surgery, okay? I've seen this patient 4 times in the last month, or in the last 5 weeks. What does that mean?
Uh, it means that this patient is mine and continuously followed by myself by me.
Mm-hmm.
And if you have no more need to know more information, say can contact to me and I help you. Or maybe after the treatment, you can refer the patient to me.
Mm-hmm. Also, it means that you're saying to the consultant that this patient is very anxious, and this patient, whatever I say, whatever I do, the patient is not convinced. Okay.
Yeah.
Or if I say, for example, um, yeah, this patient's sister had the same problem, and she was seen by yourself, and she had a breast lumpectomy plus reconstructive surgery. Therefore, she would like to be referred to you. So, what are you saying?
I think that we transfer the patient's desires.
Okay. And these are the side matters, what they're relevant. So it's a relevant connection. The surgeon might ask, why are you sending this patient to me?
Yeah.
Why aren't you sending this patient to another surgeon? Okay.
Yeah.
So you actually add this to your letter, and these are the side matters that are significant, basically. Okay.
Yeah.
Good.